Hi, this is Paul Wise and welcome to the Lawn Vet video series. In this short video I'm going to be sharing some information about the advantages of having your dog castrated. Breeding control. A castrated dog cannot sire puppies. You may wish to have your dog castrated to prevent inappropriate breeding with other dogs in the household. Please note, the dog can still sire puppies for up to 6 weeks following castration. Behavioural advantages. Castration is good at controlling aggression towards other male dogs, straying to attract down bitches in season, and inappropriate sexual behaviour. It is not a cure-all for all behavioural problems, and a behavioural pattern that has already been learnt may persist after your dog has been castrated. Although it can calm a dog down, it will not always have this effect. Medical advantages. A castrated dog will not suffer from testicular tumours, many forms of prostate disease. It also reduces the incidence of perineal hernia and anal adenomas, a small benign anal growth. Many of these problems can be solved by castration at the time of occurrence, and testicular tumours in most dogs are benign. Castration does not prevent prostate cancer though. In dogs, fortuitously, this is uncommon. Dealing with retained testicles. If one or both of your dog's testicles have not descended to the scrotum, they have a high risk of the most aggressive form of testicular cancer. We recommend retained testicles be removed, and as a dog with testicular cancer should not be bred from, a full castration should be performed. There are some minor issues with castration. Weight gain. A castrated dog needs less food than an entire male one, and activity levels sometimes fall following castration. If feeding is not adjusted appropriately, weight gain can result. Behavioural changes. Whilst the behavioural effects are often desirable, some dogs will be less energetic and a little less active following castration, which can be undesirable if you want an active dog. Anaesthetic risks. There are risks of complications with any surgery. This is a minor procedure, and with modern anaesthetic techniques the risks are very small. Hair coat changes. Some individuals may show some hair coat changes. For example, many of spaniels develop a longer, thinner, wispier coat once castration has been performed. Wound complications. The majority of wound complications are caused by excessive licking in the wound and can result in soreness and scrotal swelling, or even wound breakdown. To prevent this, we always supply a buster collar. When should your dog be castrated? The age at which castration is performed is highly variable and dependent on many factors, including breed and behavioural maturity. There is no upper age limit for castration. If you are considering castrating your dog due to behavioural problems, please contact us. We can advise if the operation is likely to help or possibly make the problem worse. Castration will change the relationship with other dogs in the household, so do get help beforehand. Occasionally, we may recommend a behavioural referral first. The operation itself. Castration is the surgical removal of the testicles. The procedure involves a general anaesthetic, so your dog will need to come into the surgery as a day patient. He'll be given a pre-medication injection before the operation. This will calm him and ensure a smooth, pain-free recovery. Both testicles are removed through a single incision in front of the scrotum. Post-operatively, the most important things would be to check the appearance of the wound, to prevent your dog from licking it with that buster collar, and to prevent and limit his exercise by keeping him on a lead. The scrotum is not removed during surgery, so it can appear at first as if nothing has been removed, especially if there's a little swelling after the operation. However, the scrotum will gradually shrink as time goes by. Usually there will be stitches in the skin which need to be removed after about 10 days. As always, if having watched this video you have any questions or you encounter any difficulties, then please phone or email the surgery. We're here to personally help, give you the very best advice and treatment possible for your much loved pet. Thanks for watching. Any feedback regarding this video would be very much appreciated.